Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit, consumer-centered organization committed to fulfilling the health and residential needs of communities across Massachusetts that we serve. I'm your host, Jennie Sutherland. Are you breathing? Yeah. My guests are now breathing and smiling. Hello. We have Dr. Deborah Reed,
hello,
audiologist from Ascent Audiology and Hearting, located in Hadley in Pittsfield, Massachusetts.
That's correct.
Just trying to apply to if you ever do a commercial.
Okay.
And this goes south for me.
Yeah.
All right.
It's called Ascent, though.
Oh, really?
Yeah. Like
I'll work on that.
Ascent your hearing.
Ah.
Yeah.
Not accent.
Right.
All right, I'll work on that.
That's another practice.
That's a different story. All right. Well, I better get this woman's place of work right, since it's mine too. Susan Tolles, Nursing Quality Manager from Berkshire Healthcare Systems. Thanks for coming on too.
Thank you.
I am bringing the two of you together because falls and hearing, I did not realize, play a part in each other.
Yes.
And falls certainly is on your mind quite often, and when you brought this up, I think this is fantastic to talk about. Plus, you have cool things, so let us talk about that. Susan, falls and seniors, older adults, bad, yes?
Very bad, very bad. We were talking earlier about how gravity prevails. That's one thing that's for sure. And, you know, as we get older, the likelihood of getting hurt, as opposed to picking ourselves up and dusting ourselves off with a little bit of embarrassment chucked in, you know, we're more likely to get seriously hurt as we get older. So everybody's at risk to fall, but we have to look at individual risk factors. So, and hearing is absolutely one of the senses that can be affected as we grow older, and it's nice that we're here to talk about that.
Looking forward to it.
So Dr. Reed, you brought some things in, and before the show you were talking about this, and I think this is fascinating, so I'm going to ask you if you want to bring that stuff up or talk. Yeah.
Sure, well, I brought my big ear model.
And we didn't start off with that on the table because I would have just been looking at it.
Yeah, no, it's good.
It's a good
bring
thing.
The prop up. So one of the things that our hearing organ does is control our balance. So the cochlea is a part of our ear that's responsible for processing sound, and then the vestibular part sits on top of the cochlea. It all goes into the same nerve. Whoops.
That's bad.
That's just an eardrum. You don't really need an eardrum. So
we don't need that there.
So what happens sometimes is that there's three parts of our balance system. There's our eyes, how we see. There's our proprioceptors, how we feel our feet in the floor. And then there's how our ear perceives our head in relation to gravity. So all those three components work together to keep us in balance and keep us knowing where up and down is.
And that was something you said just before the show, and I was like, well, I've never thought of that.
Yeah.
Seeing, yes.
Yes.
Feet, yes.
Yep.
But the hearing and was just fascinating to me, and we're talking to different sides are talking?
Yeah, so in the balance canals are called the semicircular canals, and they work just like a carpenter level. So each canal is like fluid filled, and there's a little, they keep track of where our head is in relation to the different planes. So we got our horizontal plane, that's our horizontal plane.
There we go.
And then we have the diagonal plane, and then the vertical plane, that's the vertical plane. So they all talk to each other. So this horizontal canal talks to our other side, and we figure out where we are.
So how to balance ourselves.
Yeah, it's really cool.
Yeah, I mean, you just don't think about that.
No, you don't. So, and then when one of the most common things that can happen is there's little I don't know if anybody's had a vertigo that someone said, oh, the crystals got loose in my ear. Well, what that happens is there's these little crystals that help relay information to the auditory nerve, and they can become dislodged, and they just kind of float around, and then that little bubble doesn't know where it's supposed to be, so we get vertigo and we just start spinning around.
Whoa.
And then we put the crystals back in place with physical therapy, and we're good again.
I'm sorry, I'm like, what?
Yeah,
Vertigo is a really horrible thing to have, because not only is it your balance and your sense of balance and this dizziness, but that can also lead to, your stomach is upset because your brain is just sending all kinds of mixed messages.
Yeah.
And you can really feel pretty terrible with that.
Right.
Yeah, like nauseous, and
Yeah.
like a car sick feeling.
Yeah.
And every time you move your head, it's a different spell of that nausea.
And that's partly because of the crystals and the fluid being off
Yeah,
balance.
that's one of the most common causes. There's other causes too that can have to do with our cortex, how our brain is processing movement.
So all this affects our balance. And when any of this goes awry, we can have a fall.
Absolutely.
So if you notice some things, what should people do? I mean, clearly vertigo is...
Well, certainly if you're experiencing any kind of dizziness, you should, get up slowly. And, not be afraid to ask for help. Whether that be from a family member or, wherever you are, if you're feeling dizzy, it's best to stay seated.
Yeah.
Right. And because, again, as I said, gravity will prevail.
My dog and his baby on our couch, they practice that every night. Well, how did that happen again, Isabel?
So we want to avoid that as we get older, especially.
Yes.
Because as I said, a fall can lead to very serious injuries and fatal injuries for that matter. So really need to be careful.
So Berkshire Health Systems must have a balance. Do you have a balance clinic or the physical therapist?
Well, we do have physical therapy, and some of the components of physical therapy include, balance strategies and things to improve balance. I am not certain, however, if they actually do the movement exercises to realign the crystals.
Yeah.
I know that from people I've known that have had vertigo episodes and have had that done, and just absolutely felt that it was a miracle.
Yeah.
To do these movements and realign the crystals.
So besides, you said the realign the crystals different ways, are there any pieces of equipment that can help with balance and hearing that you would help people with? Hearing devices?
Yeah, so
or
you think about the aging process. We lose our vision. Our vision changes, I should say. We don't lose it. So our hearing changes, and then just our reflexes change too, like catching ourselves when we're moving wood and that sort of thing. So when we can shore up our senses. So if you wear glasses, use your glasses. If you have some neuropathy in your feet, use your cane. That my grandmother, she's 100. She carries her cane looped around her arm, and she just walks around.
So it's an
falling all the
accessory.
time. Yeah.
It's an accessory for her.
It's like, no, use it. It helps you figure out where your feet are in gravity. And then the other important thing is to treat any hearing loss that you might have. So when we have good hearing cues where we are in the environment, it helps reinforce our vision and our proprioceptors.
And I think sometimes with hearing appliances, people are self-conscious about the size of them or the look of them.
Yeah.
And I know that, they've evolved greatly
Yes,
over the
yeah.
past few
Yeah.
years, that they're little tiny instruments versus something that wraps around the ear and
Yeah.
a cord that runs
Yeah.
down through over your chest.
I was thinking of that big thing.
Yeah.
The
I know.
horn.
I didn't bring that today.
You didn't bring the horn.
But yeah, it's true. So this, I actually use one of the hearing aids, and it's this small. So all that's in
Wow.
my ear is this little wire. And the nice thing about this is it works with my iPhone, and there's an app on it that I can control the sound, and I can use my hearing aid as a Bluetooth device. But what I wanted to bring up was the balance component. So in the hearing aid, there's sensors that can register if I fall, and it sends it a little alert. And then if I don't, say you're my emergency contact person and I've fallen, and my hearing aid tells my phone, oh geez, she's on the ground, I have a couple minutes to respond that I'm okay. And if I don't, you're going to get a text alert from me, and then my phone will tell you where I am and
That's
if I need help.
incredibly awesome.
So,
That is awesome.
yeah, because I can imagine, some older people who live alone and they fall, sometimes they're not by the phone, or they can't get help
Right.
until someone comes over, and that's not always a daily.
We've seen
visit,
far
so-
too often people who've been on the floor for how long, Susan?
Hours and hours.
Days.
In
days.
in pain too.
In pain, with a broken bone, and it can lead to severe destruction of muscle tissue from lying on a hard
Dehydration.
surface.
Pressures.
Yeah.
And so it's really important for people who live alone or are at home alone for extended periods of time to have the ability to get in touch with someone. Not that they can't be left alone, but just in the event of an emergency, they
Yeah.
have a way to contact someone.
This is a wonderful device.
Yeah,
This is phenomenal.
so this is great where technology comes into play and improves the quality of our life, keeps us more independent, keeps us in our own home, and we don't have to.
Yeah. Can keep our independence for as long as we can
Right.
safely.
Yep.
That's really, really cool. So we're going to take a quick break right now, ladies. I'm going to play with the ear. Folks are going to watch a clip about our affiliate down in Great Barrington, Fairview Commons Nursing and Rehabilitation Center, and we'll be back, and Susan and Dr. Reed will stay with me. So back in a minute.
Nestled amidst the wooded and serene town of Great Barrington, Fairview Commons Skilled Nursing Center is minutes from downtown, in the heart of the beautiful and culturally rich Berkshire County in western Massachusetts. Fairview Commons offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Fairview Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Fairview Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice care, adult day services, and respite care. Fairview Commons offers a state-of-the-art, amenity-rich short-term rehabilitation suite for those primarily recuperating from orthopedic or cardiac surgeries. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need. including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Fairview is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident at Fairview Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Fairview Commons, we're perfecting the art of superior care. If you or a loved one needs short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-528-4560. We look forward to meeting you.
And welcome back to the show. We just saw a little clip on Fairview Commons Nursing and Rehabilitation Center down in Great Barrington. I've been spending some time down there with those friends working with an adult day health program, asking folks to come and meet Marilyn and Cindy, the staff down there. I know, Susan, you've been down there. Mm-hmm. If you're interested in those services and finding out more about adult day health, you can call 413-528-7120. I have to read it because I just press a button on my phone and magic, it is connected. So we've been talking about falls prevention. That is just a phenomenal way to show balance with the balance thing.
Yeah.
So thank you. And that piece of equipment that lets folks know you've fallen, it is just a great thing for people to keep their independence as long as they can. So we're in the middle of a cold spell. Winter is here. There's snow some places. There'll be more snow. People will be outside. And it is also the flu and illness season. The other thing you think about. You have a line. You're going to say your flu.
Open the window. And influenza.
She was on the show, did a whole show on the influenza, and her big ta-da was reading a poem about this with that line in it.
That's
so
right.
Flu is on your mind, and I know these illnesses can affect your hearing, and sometimes they mask each other or mimic each other, and balance can be affected. I've had a head cold that was terrible, dizzy. So flu.
Exactly. Well, the thing about a head cold and your hearing is your sinuses and your nose are connected to your ears, and when all of that gets filled up when you're having a cold,
there's pressure in here.
Affect the hearing as well as your balance and can create problems. So for influenza, I can't stress enough the importance of annual immunization. While each year the flu vaccine may work at different levels, and just because you get a flu vaccine doesn't mean you're 100% protected and you're never going to get the flu. But it is the first line of defense and our best defense at this point. That coupled with washing your hands and keeping your hands away from your face. And the other thing that I tell people is to refrain from being in crowded spaces where people might be ill. Because the thing with influenza is you can have influenza for up to 48 hours before you have any symptoms at all. So you don't even realize you're sick, and you can be spreading it to others. And certainly vulnerable people, the top of that list are children and the elderly. So it's very important to get a vaccine every single year. As I said, it's not 100%, but it's the best first defense.
So when you do have one of these illnesses, I think we need to remind people to be mindful and pay attention to things so you're balanced, because you're more prone to falls. We're talking about the pressure in the ears. Do you think that's true?
Yeah. Yeah, I think that, and when we have an illness, especially the flu, we have a fever, we can be dehydrated.
So it's all those things you were talking about, or so it's all kinds of things compiled.
Right.
It's amazing to think about that balance, and again, a great way to demonstrate that. I was talking with you earlier, and I said I'm out snow blowing, and I probably should wear ear protection, huh? Because of the noise?
Yeah, it depends. You know, OSHA says that 85% of us are safe with 90 decibels of noise for 8 hours. The more conservative approach that I like to recommend is 85 decibels, because that's 100%. So you might be susceptible to a hearing loss. So even though 90 decibels is safe for me, it's not safe for you. So if you think of that,
I think that's.
And snow blowers are probably, you know, in that 90 up to 100 decibel level. So if it's going to take you longer than 15 minutes to snow blow, I would wear hearing protection.
Oh, heck yeah! It's going to take me longer than 15 minutes. If it only took me 15 minutes, I wouldn't need a snowblower.
Right.
Let me just tell you that. Well, that is good to know. And I like the way that you talked about it. I know OSHA has its standards, but that is sensible, taking into consideration that we're all a little bit different.
Yeah. So we want to look at the absolute 100% protected.
Okay. And then I just wanted to quickly cover this, because it's a hot topic for my mother, is the shingle shot.
Yeah.
And you both kind of chimed in earlier. So for my mother, please address the shingle shots.
Well, the new recommendation from the CDC is the Shingrix vaccine, which requires 2 vaccinations. You get 1, and then 2 to 6 months later, you get the second dose in the series. So it's a 2-dose series of vaccines. It lasts about 5 years, and it's recommended for people over 60. And most insurances will pay for it. Some with a copay, but most insurances will pay for it. And it's very important for an older adult to get the shingles vaccine, because most people over 40 years old have already had chickenpox, whether they know it or not. It may have been a very mild case, and they may have had it when they were very young, or they've been immunized against chickenpox. So it makes sense to get the shingles vaccine, because shingles is not contagious like chickenpox are contagious. It's really a resurgence of your own chickenpox virus within your body. So the shingles vaccine prevents a shingles attack from occurring, and it will also help if you've already had a case of the shingles with what's called post-herpetic neuralgia, which is the pain syndrome that is caused following a shingles
Because
episode.
people will say it's very painful.
It
And
is.
besides painful, it can be damaging overall, and it can damage your eyesight and your hearing.
Yeah, it affects our nerves, so.
So get your
That's it,
shingle shot.
yeah.
Right.
So Barbara Sutherland, get your shingle shot.
That's correct.
Okay.
The reason why it affects your eyesight and your hearing, as Deb just said, the facial nerve runs across to about midline of your nose,
Yeah.
up this way, and up this way. And that's the nerve that is affected that will cause hearing loss and potentially sight loss.
Wow. All right. Well,
And the doctor can take it away on the rest of the anatomy lesson.
we're going to get one of those so she can do that. All right. Well, I want to thank you both for coming on. I would ask you again when we come up with some other topics, just so you can bring more of these
Yeah,
things
sure.
on. Thank you. I want to thank you out there for watching and remind you that InfoSource is a presentation of Berkshire Healthcare Systems. Until next time, I wish you good health and good life. Bye-bye.